Again, I'm Dr. Mark Trolice at Fertility CARE, the IVF Center here in Orlando, Florida. And I thought that we would talk today of optimizing natural attempts at conception. You know, of all the things that I discuss with my patients, it seems like that's the area that there is the most confusion. Of course, when you're trying to conceive and having some difficulty, all of your friends and family give you advice that isn't really always medically evidence-based. So let's start from the beginning. What do we know that we need? Okay, well, we know we need a woman to have regular menstrual intervals, okay? And that usually can assure us that she's ovulating, but it doesn't always. How can we know that a woman is ovulating? Well, to answer the question completely, it's if you conceive, okay? But other ways to determine if you're ovulating are cervical mucus, okay? The cervical mucus gets really, really watery right before you ovulate. And then after ovulation, and that the watery mucus is from the estrogen, but after ovulation, it becomes thicker from progesterone, and it prevents other sperm from entering the uterine cavity and to reduce the risk of infection for the pregnancy. Lower abdominal cramping, called Mittelschmerz, precedes ovulation. Right before ovulation, you should get some of that cramping. You don't always. Other things, basal body temperature charts, they're really difficult to use to time intercourse, but basal body temperature charts looks at your temperature in the morning, and typically it stays below 98 degrees, and then it will go above 98 degrees and usually stay there for 10 to 12 days. But that only tells you that you ovulated in the past. The best prospective way to determine when you're ovulating is using an over-the-counter ovulation predictor kit. Now, what this kit is determining is it tests the urine for the pituitary hormone called LH. And it surges about 24 to 36 hours before ovulation. So if you check your urine every morning and it starts getting darker and darker, and then it matches the test kit, that shows that you'll be ovulating within a day, day and a half. Okay, how does that affect your ability to conceive? Well, what most people don't realize is that the most optimal times to try to conceive are the days leading up to ovulation. So if you get that color change today, and you'll be actually ovulating tomorrow or a day and a half, count from that next day backward over those 6 days. And it's the 6 days preceding ovulation that are the optimal times to have intercourse, every day to every other day. I wouldn't go further than every other day, because the more sperm in the reproductive tract, the better. Okay? And then after you get that color change, that following day, that would be the last day that would be most optimal to try to conceive. Okay? And of course, the other things are optimal sperm count. You know, the over-the-counter sperm kits are not very accurate, so if there's a concern, certainly go to a reproductive biology center. So the three things that we need ovulation, we need a good amount of sperm, and we need open fallopian tubes. And if there's any worry about that, then you do a hysterosalpingogram. This is a procedure we do right here in the office under X-ray, minimal radiation exposure. We place some dye through the cervix, and we can see the dye go out through the fallopian tubes to give you that assurance. But if you're having regular menstrual cycles, use an ovulation predictor kit, increase the frequency of intercourse for those 6 days up until ovulation, and hopefully you're successful. About 85–90% of you will. Until next time, this is Dr. Mark Trolice at Fertility CARE, the IVF Center here in Orlando, Florida. Have a great week.